So truth. Coronavirus spreads primarily through droplets of saliva or discharge from the nose when an infected person coughs or sneezes. Please don't be scared. To prevent infection and to slow transmission of COVID-19, follow the safety precautionary measures placed by the World Health Organization. Wash your hands regularly with soap and water, or clean them with alcohol-based hand rubs. Maintain at least 1 meter distance between you and people coughing or sneezing. Avoid touching your face. Cover your mouth and nose when coughing or sneezing. Stay home if you feel unwell. Refrain from smoking and other activities that weaken the lungs. Practice physical distancing by avoiding unnecessary travel and stay away from large groups of people. Please don't be scared of the virus. Follow the precautionary measures. Stay home, stay safe.
From a kid, Mimfam and Hanifen to Aja, I'm getting it all is so man, Muka Hanifen to Aleja. Albany lap Yadualeja, Setaburja, Dulka freedom of space the Bualeja, Dual Bela, Dua do Bualbe Bua, Allah Bolan, Esti Gambian dream, Ricama Boyu, Dulkana, Kuoliki. It's all about Gambian talent TV. Tune in direct, ala GB, stay tuned, Mimbekering Gambia, Bantala, Gambia. Look!
Coronavirus exists. Coronavirus is a disease that attacks the respiratory system. The symptoms of COVID-19 are fever, tiredness, dry cough, shortness of breath, headache, sore throat. Coronavirus spreads primarily through droplets of saliva or discharge from the nose when an infected person coughs or sneezes. Please don't be scared. To prevent infection and to slow transmission of COVID-19, follow the safety precautionary measures placed by the World Health Organization. Wash your hands regularly with soap and water, or clean them with alcohol-based hand rubs. Maintain at least 1 meter distance between you and people coughing or sneezing. Avoid touching your face. Cover your mouth and nose when coughing or sneezing. Stay home if you feel unwell. Refrain from smoking and other activities that weaken the lungs. Practice physical distancing by avoiding unnecessary travel and stay away from large groups of people. Please don't be scared of the virus. Follow the precautionary measures. Stay home, stay safe. Coronavirus exists. Coronavirus is a disease that attacks the respiratory system. The symptoms of COVID-19 are fever, tiredness, dry cough, shortness of breath, headache, sore throat. Coronavirus spreads primarily through droplets of saliva or discharge from the nose when an infected person coughs or sneezes. Please don't be scared. To prevent infection and to slow transmission of COVID-19, Follow the safety precautionary measures placed by the World Health Organization. Wash your hands regularly with soap and water, or clean them with alcohol-based hand rubs. Maintain at least 1 meter distance between you and people coughing or sneezing. Avoid touching your face. Cover your mouth and nose when coughing or sneezing. Stay home if you feel unwell. Refrain from smoking and other activities that weaken the lungs. Practice physical distancing by avoiding unnecessary travel and stay away from large groups of people. Please don't be scared of the virus. Follow the precautionary measures. Stay home, stay safe. Coronavirus exists. Coronavirus is a disease that attacks the respiratory system. The symptoms of COVID-19 are fever, tiredness, dry cough, shortness of breath, headache, sore throat. Coronavirus spreads primarily through droplets of saliva or discharge from the nose when an infected person coughs or sneezes. Please don't be scared. To prevent infection and to slow transmission of COVID-19, follow the safety precautionary measures placed by the World Health Organization. Wash your hands regularly with soap and water, or clean them with alcohol-based hand rubs. Maintain at least 1 meter distance between you and people coughing or sneezing. Avoid touching your face. Cover your mouth and nose when coughing or sneezing. Stay home if you feel unwell. Refrain from smoking and other activities that weaken the lungs. Practice physical distancing by avoiding unnecessary travel and stay away from large groups of people. Please don't be scared of the virus. Follow the precautionary measures. Stay home, stay safe. Coronavirus exists. Coronavirus is a disease that attacks the respiratory system. The symptoms of COVID-19 are fever, tiredness, dry cough, shortness of breath, headache, sore throat. Coronavirus spreads primarily through droplets of saliva or discharge from the nose when an infected person coughs or sneezes. Please don't be scared. To prevent infection and to slow transmission of COVID-19, follow the safety precautionary measures placed by the World Health Organization. Wash your hands regularly with soap and water, or clean them with alcohol-based hand rubs. Maintain at least 1 meter distance between you and people coughing or sneezing. Avoid touching your face. Cover your mouth and nose when coughing or sneezing. Stay home if you feel unwell. Refrain from smoking and other activities that weaken the lungs. Practice physical distancing by avoiding unnecessary travel and stay away from large groups of people. Please don't be scared of the virus. Follow the precautionary measures. Stay home, stay safe. Coronavirus exists. Coronavirus is a disease that attacks the respiratory system. The symptoms of COVID-19 are fever, tiredness, dry cough,
shortness of breath,
headache, sore throat. Coronavirus spreads primarily through droplets of saliva or discharge from the nose when an infected person coughs
or sneezes.
Please don't be scared. To prevent infection and to slow transmission of COVID-19, follow the safety precautionary measures placed by
the World Health Organization.
Wash your hands regularly with soap and water or clean them with alcohol-based hand rubs. Maintain at least 1 meter distance between you and people coughing or sneezing. Avoid touching your face. Cover your mouth and nose when coughing or sneezing. Stay home if you feel unwell. Refrain from smoking and other activities that weaken the lungs.
Our colleagues from the media for always being on our side since the start of the pandemic way back in January to now. So we want to thank you for all the effort you have been doing on behalf of the ministry and on behalf of Honorable Dr. Samote. We want to say thank you for all the support. And I now have the singular honor to invite Honorable Ahmed Lamin Samote to come and give you the statement, the press release with regards to information to update you as to what is happening. Honorable, welcome.
Thank you, Well, no space for my paper. Thank you. Yeah. Good afternoon, ladies and gentlemen. The 22nd National Situation Report since the confirmation of the first case of the novel coronavirus disease, COVID-19, in the Gambia on the 17th March 2020 reveals the following. 1. 4 people who sneaked into the country through the land borders were found through a community tip-off to the 1025 hotline and have been taken into quarantine. Sites have been secured for makeshift COVID-19 treatment centers in all the health regions in the country. Western 1 and Western 2 health regions continue to register the highest number of calls to the 1025 toll-free hotline. The 4th case that has been diagnosed in this country is still on admission and is responding to treatment. A total of 76 new laboratory test results have been received recently. 5 were positive, 1 inconclusive, and 70 were negative. 2 of the confirmed cases were in quarantine and later on home isolation on account of recent travel from the United Arab Emirates. 1 other confirmed case was in quarantine and also later on home isolation on account of recent travel from the United Kingdom. The remaining 2 confirmed cases are still in quarantine for being close contacts of the 4th confirmed case. The inconclusive case also has a travel history of recently returning from the United Arab Emirates. Currently, the country has 6 active cases, 2 of which were locally transmitted. We have 2 inconclusive cases, 2 recoveries, and 1 death. To summarize again, the Gambia has recently registered 5 confirmed COVID-19 cases. Globally, since 31st December 2019 and as at 10th April 2020, a total of over 1.6 million cases of COVID-19 have been diagnosed, have been reported. Of these, there were over 100,000 deaths, over 370,000 recoveries. Senegal, our neighbor, recorded 265 confirmed cases, 137 recoveries, and 2 deaths. Currently, we have 47 people on quarantine in one of the hotels in the Greater Banjul area. A total of 200 A total of 281 tests were conducted and 9 were positive. 270 were negative and 2 were inconclusive. 253 people completed quarantine. 233 contacts have been traced so far, and 310 people completed follow-ups. With regards to the coordination, case management, logistics and security, laboratory and surveillance, as well as risk communication and community engagement, the following activities were carried out: daily coordination meetings, ongoing at both the strategic and technical levels. We are intensifying the conduction of laboratory tests for a wide range of people. Case management and infection prevention and control training of health facility staff, covering both public and private health facilities, ongoing, and the provision of regular psychosocial support for people in quarantine as well. The 4th case is still receiving treatment and his condition remains stable. The 5 new cases have been taken to join him at the government treatment center. In the area of logistics and security, all the regions in the Gambia have received stockpiles of personal protective equipment. Risk communication and community engagement activities are ongoing and are being intensified. In the next steps, the Ministry of Health, in collaboration with partners, will intensify the following actions. We will partner with other stakeholders and communities to continue with the massive sensitization on COVID-19. We will follow up and provide continuous psychosocial support to the affected communities, persons under quarantine, people who have just been discharged from both quarantine and the treatment centers. We'll also continue daily follow-ups of low-risk contacts and those discharged from the quarantine centers as well. We encourage public reporting and self-reporting of high-risk individuals through the toll-free number 1025. We'll also be engaging inspectors of the State of Public Emergency Regulations 2020 and documenting best practices of compliance while identifying challenges that require urgent attention in the interest of public health. Finally, I would like to appeal to the regional governors, to the district authorities, the ward development committees, the councillors, village development committees, religious and other community leaders, heads of women groups, heads of households, and family members to be very vigilant and ensure the full implementation of the suspension of public gatherings in whatever form, and to ensure the practice of social distancing. This strategy will certainly help us reduce the spread of the virus in our communities, and this becomes more relevant now that we have started to register local transmission. I would like to conclude by commending all the communities that established and support the work of the community vigilantes in tracking people entering into the Gambia from affected countries and communities along the borders. The Ministry of Health salutes this important community initiative and will urge all communities in the country to embrace and establish such community COVID-19 monitoring structures. Community participation and involvement in the COVID-19 interventions is essential. Together we can make a difference in our efforts against COVID-19 in the Gambia. Once again, I thank you very much for your kind attention.
Yeah. Thank you. Now we invite Sankano to lead to facilitate the question and answer session.
Good. Go on.
Thank you very much, Honorable Minister of Health, Dr. Ahmad Lamin Samat, for that important update. Members of the media corps, the floor is now open for questions. Your name and your media institution and question. Yeah.
Okay, good afternoon. My name is Sugaya Yusi from Gambian Talents TV, and I want to know why the sudden change. Because we have not been registering cases for the past 2 weeks now. So why the sudden change? We having 5 new cases.
Okay. Honorable.
Well, this is the epidemiology of diseases. They have various epidemiological patterns, how and when they present, which is usually not under the control of the health personnel per se. But looking at the pattern, looking at the incubation period, and looking at when we started registering the cases, we had been anticipating an increase in the level of the cases based on this particular epidemiology of this disease. If you look at what happens in many other countries, 3 to 5 weeks after registering their first case is when they saw the explosion of cases. In most countries, that's what happened. That is why we had been singing the song of Gambians not being complacent just because we had 4 cases. We should be aware that COVID-19 is a reality, and this is actually the time when other countries who have had unpleasant experiences with COVID-19, this is when they started seeing the exponential increase in the number of cases. So this is why we should still practice, continue to practice the sanitary habits, the etiquettes of coughing and sneezing, equally the social distancing. We should emphasize that. Social distancing is very important, especially now that we have seen that we have started to register locally transmitted cases.
What I want to ask is there any connection between these 5 people who are infected, or are they from different background, because they are connected? Maybe one can prove their transmission from somebody who was having infection. So are they from like a connection that?
Yes, yeah. Thank you. As we said earlier, 2 of them were close contacts of the 4th case that is currently under treatment. So we believe those are locally transmitted cases. The fact that those 2 do not have a travel history, but they live together with the 4th case in the same compound. The other 2 also came from travel from the same place, and they were all together, coming from the country where they were all staying in. And it is important to emphasize that these people are all Gambians, and it is also important to emphasize that they are all, most of them are young. 2 of them are 20 years old each, and the other 2 are 28 years old each. So we have 2 people 20 years old, 2 people 28 years old, and the other individual is in his 60s. Why are we emphasizing this? We are emphasizing this to let the young people know that young people are also vulnerable. We've seen in other countries it affecting more of the older people, but that doesn't mean young people are not vulnerable, and we should all be very responsible citizens, even if the young people withstand the disease. But they could infect people, loved ones, people in the communities who may not be able to withstand the disease. So it's our collective responsibility to make sure that we carry out what we need to do for the prevention of the disease, against the disease. Yeah.
Thank you.
My name is Aisha Tukodo and I am from Gambia Talents TV. My question is, what assurance will you give to the Gambian people, because Gambians do not have confidence in the Ministry of Health regarding the COVID-19, and as among yourselves here, they are not taking it seriously. In other countries, if you see the team that is responsible for COVID-19 on the TV screen, they are taking things seriously. But likewise in the Gambia, it's a different case. So what assurance will you give to the Gambian people that they should still have confidence in the Ministry of Health?
Well, I think maybe this is just your own individual view. This is the first time I'm hearing this. So this is your own view you are putting as you are representing the people of this country. So I think this is your personal view.
No,
but nonetheless, I will respond to your personal view. A lot of people have demonstrated confidence in the Ministry of Health of the Gambia for what we are doing. If you want us to appear here and put on suits to look serious, then I think you are missing the point. We are workers. We are running around between the quarantine centers, between the treatment facilities, building up new facilities, responding to the equipment needs of this country, talking to the people, following the people who are doing the follow-up. So if we are not wearing suits and looking as you expect us to look, then that is misleading. But I think by the virtue of the Gambians who are sending their congratulatory messages, their messages of support, their messages of solidarity, I think the Ministry of Health is doing very well. Now, compared to what is happening in other countries, the Ministry of Health started very early. We started earlier than most other countries. We started the follow-ups, the preparation earlier than most other countries. We started the response earlier than most other countries. And you will be shocked to know our proactive nature is what detected these cases. You know what would have happened in some other countries when people complete quarantine because they did not manifest the symptoms and signs, they would have been let to go home. And we insisted, based on our knowledge, and I think we are all happy that we have very knowledgeable people in this ministry to deal with such. But based on those knowledges that we have and the experience that the people have, we insisted anybody from the quarantine centers must be screened. So all these 5 cases would have been lost if not for our intuition, if not for our competence, if not for our educational levels, if not for our hard work. So I think that's why the people of this country know that COVID-19, there is a serious team that is going ahead with the strategies to deal with COVID-19. And going by the efforts, I mean, if a country that had 4 cases, you think that country is not serious. I wonder what you will say about the countries that have tens and thousands of cases with their strategies. Thank you very much. Yeah.
My name is Clarifies. Now that we have started registering local cases of infections, the COVID-19, what is next for the ministry in the fight against COVID-19?
Well, it's to intensify what we are doing. You see, we are intensifying the follow-up, the contact tracing. Anybody who has had a link to these people are being followed up. In fact, as we speak, There are a lot of people doing these kind of things. So we intensify the follow-up. We're going to be doing a lot more testing, but we also appeal to the people of this country. This is not a Ministry of Health issue alone. The ministry can do what it can do, but the ministry cannot make you practice social distancing. People of this country must take their own, they must be responsible. They should participate. Otherwise, the government's efforts will not yield the results that we desire. If we say social distancing and people want to do things as they were doing before, and when there is local transmission and people blame the government for that, is it the government that has taken the virus from one person to the other? No. But we say if we know that it is communicable, we now know the routes of transmission. They say let us stay away from each other, and people still want to socialize as nothing is happening. So I think the Gambians, we need to take the disease seriously. That's why we've been singing that we should not be complacent. COVID-19 is real, and you see it is on the increase if we do not practice social distancing. Let me give you an example. The locally infected, the local transmissions, most probably, if there were some social distancing, those two people who are family members of the fourth case wouldn't have had that disease. So that needs to be practiced. We need to answer, and we continue washing our hands. And we stay indoors when we have no business in being outside. I think we need to continue to practice this. Thank you.
Gentleman.
And it testing freely and what? The friend because you what? And yeah, I'm thinking. I'm a big friend because you test. So, Anila Vateske 1025 call. 1025. He call. It all be alone na lebe minkela. E be alone na lebe nyini kala min ne ba alone na lebe steps all min tala. Puri se futa no testing dulato ise test ke. Test mu free let. Dawoda banko beka. Niye o problem was so the 1025 call and then niye futa je. A test because you. Yeah.
One last question, final question.
The message still not to be getting to the average Gambians, because we have seen in the market Gambians are still gathering in the market, going about their own businesses. And also we have seen in the garages and campus all the booths. So what other awareness or what are other measures that are to be taken in order to keep the people in their houses only?
I think the message is actually getting to them. It is now for the people to react to that message in the interest of them, their families, of themselves, and the interest of the country. I don't think anybody, most of the people who sit in those booths now know what the government has been saying, what our people have been saying with regards to social distancing. It is just that they do not want to practice it. Now, we have a civilized country, and we have a democracy where the rule of law is respected, and we want, as a government, to act in a civilized way by encouraging people to do what they need to do. You have all seen what is being practiced in other countries. But our government says, let us talk to people, let them do what they need to do. And I think people should listen to that. But of course, if the cases are going to increase, if other people are going to put at high risk because some other people are refusing to practice what needs to be practiced, well, I think government probably will review that situation again and react accordingly. Thank you very much. Yeah.
Thank you
Good.
very much, Honorable
Yeah.
Minister. Thank you all. And as the Minister said, the use of force is a last resort. We are following the due process. And people have been asking one question I would like to make clear. There are some citizens of the Gambia outside who wants to come back. I think there was already an announcement made that anybody coming from countries with confirmed cases, you have to be subject yourself to quarantine. Citizens of the Gambia, you have right to return. But it must be clear that you must subject yourself to quarantine. And then, as the minister said, we are working. Yesterday we were at the border, so that's why we will not be in suits and comfortable, Nyeti Morso. We are working hard. Thank you very much and see you tomorrow. Thank you, Honorable Minister.
Thank you very much.
Thank you, Director Modunyai, and thank you, Dr. Vite and the team. Thank you all.
Thank you. Thank you all very much. Thank you.
Coronavirus exists. Coronavirus is a disease that attacks the respiratory system. The symptoms of COVID-19 are fever, tiredness, dry cough,
shortness of breath,
headache, sore throat. Coronavirus spreads primarily through droplets of saliva or discharge from the nose when an infected person coughs
or sneezes.
Please don't be scared. To prevent infection and to slow transmission of COVID-19, follow the safety precautionary measures placed by
the World Health Organization.
Wash your hands regularly with soap and water, or clean them with alcohol-based hand rubs. Maintain at least 1 meter distance